So we're going to take a moment to look at the facial structure. So I've said quite a bit of things with respect to osteopathy in the cranial field, and I've built my position. So if you look at some of my Don't Believe the Hype videos, I talk about some of the claims that are made by cranial osteopathy. One of the things that I'm very careful to say is not that there is nothing going on when people are speaking about working in the cranium, but what I would say is that the claims that are made are not what's actually occurring. I've also done a video about how Dr. Still described working specifically on the nasal bones, and I've demonstrated that in the past. What I want to do is take a moment to just look and consider how one may work within the facial structure specifically. So what we are guided by are the concepts that we've used quite a bit. So the concepts of relational motion, patient active, patient passive, working perpendicular to soft tissue direction. So what we'll start off with is working perpendicular to soft tissue direction. So the muscles that are quite easy for us to get to without going inside the mouth are the muscles of mastication very broadly, right? So we're going to be in front of the ears, under the zygomatic arch, under the maxillary arch, right? Well, really the zygomatic arch. We come down, right? So it kind of looks like you're squishing somebody's face. As you come back towards the mandible, right, you'll basically be going over the maxilla and above the teeth, and then you'll hit a shelf. That shelf is going to be the anterior portion of the muscles of mastication. As I draw downwards, or not necessarily downwards, but posterior or towards the back of the head or towards the table, however you want to describe this, essentially what I'm doing now is I'm working perpendicular fiber direction broadly with the muscles of mastication. What we can do here, if we identify that one side will yield less than the other, then we can focus on the one that we choose to focus on. So if I was to focus on this side, I would keep my hands right on the anterior surface, essentially creating like a bow, and then I can have the patient gently turn left and right, very, very small, right? Yeah, and then turn left, just gentle, so it doesn't hurt. So we can do that. We can go patient passive. Same idea, that's relational motion, just so you see it on this side, right? So I'm dropping down, I'm on the anterior surface of those muscles, and patient passive, I can kind of hold and do that. Patient active, so just turn to the right, very, very slow and gentle, and then turn to the left. Right? And so basically, whether I am passively moving the patient or the patient's moving themselves, my hand stays relatively still, and the muscle stays, well, my hand stays still in relation to the skull, which will move, or the head, which will move, which creates more of that bow. We can do some of that in other areas, but the muscles in and around the facial structure don't make themselves as apparent aside from the muscles of mastication. It's not that you can't do anything. The muscles of mastication are easy to find. They are quite apparent. The rest of them, so the muscles in and around the mouth, in and around the nose, not as easy to identify. You can work on them. It's not as easy. Now, one of the other things that I'll do is I will work on the facial structure broadly. Now, we have a few handles here. One handle is the maxilla itself. One handle is the nose, right? So, as I said, if we're working on the muscles of mastication, we're considering the TMJ. I have done a TMJ video in the past, which you can go look for. But one of the things that we'll look at here is if I was to use the maxilla as a handle, right? I'll use a bit of a yoke hold. I would always tell the patient prior to doing this, I would ask their permission, and I would tell them that it's going to be tender, because often when you take that grip, it's going to be somewhat tender in the area. So you take the grip, right? You're basically holding onto the maxilla, and again, I can stabilize the head and move the maxilla in relation to a relatively stable head, or I can hold the maxilla still and move the head in relation to a relatively still maxilla. What we're looking at is asymmetry in the facial structure, keeping in mind that there's no such thing, as far as I'm aware, as a perfectly symmetrical face. Faces are somewhat asymmetrical in their bony structure. Part of that could be habits of facial expression, changing the shape of the bone over time. There could be other reasons, there could be trauma, but you will get some very, very minor motion of the facial structure broadly sliding laterally. You have to be careful, and I've talked about this in the video that I did on how Dr. Still described working on the nasal bones, that the motion that you're perceiving as the practitioner is probably not the motion of the bones in relation to one another. So if my hand moves this much, I can have the perception that that much motion is happening between the bones. So, but what's really happening is I'm moving the skull. And as I'm holding on the maxilla, I'm getting some soft tissue sink. I'm not getting as much motion as I think I'm getting, right? But we can push and pull the skull itself or the head broadly, or we can hold the head still and create some gliding of the facial structure. Now, because of the angle of the camera, you may not necessarily see much motion. Visually, I see some, but I have to keep in mind that some of that could just be the soft tissue moving in relation to my hands. It may not necessarily be the bones, so I could trick myself there. There is some movement. You will have some positive effect. The other handle, as I talked about, is essentially the nose itself, or the nasal bones. Come back over here, and you can, again, hold on, you stabilize the head, you can hold the nasal bones or the nose itself, and you can move the nose in relation to a relatively still head, or you can keep the nose relatively still and move the head in relation to that. Here you can also go patient active, so just very gently turn your head to the left and turn your head to the right. Right. Now again, because he's actively moving, the amount of force that he can create to turn the head, I can begin to think there's a ton of motion there. There is not absolutely a ton of motion, but I can believe there is. The reason that I would often consider moving or working through the facial structure, be it the soft tissues, the muscles of mastication, the TMJ itself, the facial structure, either using the maxilla as a handle or the nose as a handle, often is in relation to nasal breathing issues, nasal challenges, or possibly some trauma. If somebody's taken some trauma to the face and it's a reasonable time, it's not too tender, I can actually hold, I can make some motion there, because you do need to use a fair amount of force for anything to happen. I may work there at that point. The TMJ obviously is a different thing. Issues chewing, pain in the jaw, well, I'm happy to work there. But I just want to show you how it may look if I work in the facial structure, and I'm still guided by the ideas of contact, like contact is control, broad contact for multi-point discrimination, relational motion, patient active, patient passive, mixing all these things together. So hopefully we've shown you some of what that looks like, and also working perpendicular to soft tissue direction, or soft tissue fiber direction when working on muscular tissues. So like I said, broadly the muscles of mastication. So hopefully you get some idea of what that might look like. Again, when people are talking about working in the head or working in the cranium within osteopathy, I have a problem with the claims that are made. I don't have a problem with the work that is done and the results that may happen, that are more known by the patient than thought by the practitioner. But I do fairly reasonably, fairly comfortably work on the facial structure. There is much more motion in the facial structure. We talk, we eat, we make faces. There's a fair amount of movement in the facial structure, and my experience would suggest that there is some positives to come out of it, where my experience suggests that working on the top of the head, working in the more fixed cranium, an adult or even a teenager, you don't get as much bang for your buck. Obviously I have a perspective on this, I have a bias. That's why I've done those Don't Believe the Hype videos, where I've discussed why I say the things I say. But again, the same concepts that I utilize to work anywhere else in the body, I utilize and comfortably, happily in the facial structure when there seems to be need.